Welcome back to Primetime News. An unfounded rumor. The health minister's response this evening to claims that an individual has been diagnosed with the deadly Ebola virus in Jamaica.
The health minister says there are no suspected cases of Ebola in Jamaica, but is fully prepared and monitoring anyway. Dara Smith picks up this story.
A declaration from the health ministry.
I want to categorically state that at this time we have no suspected case of Ebola in the country. We are not investigating a suspected case, and we have no reason to consider that anyone in the country at this time is suspected of having Ebola.
The Ebola virus is a severe, often fatal illness in humans. Ebola spreads through direct contact with blood or body fluids, objects like needles and syringes that have been contaminated with the virus, or contact with infested animals. 50 to 90% of those infected can die. So how did rumors of a local case came about? The acting permanent secretary explained that a 65-year-old physician who traveled to Trinidad returned to the island feeling ill. He fell and was admitted to the University Hospital of the West Indies, where Dr. Harvey says, following a comprehensive investigation, it was confirmed that he does not have Ebola. It was revealed that there are no testing sites for Ebola in Jamaica. Samples have to be sent to the Caribbean Public Health Agency in Canada or the Center for Disease Control (CDC) in the United States. That process takes about 1 week to be completed. In the case of the suspected individual, his sample was not sent. Here's why.
For Ebola, there are some specific things. First of all, in order to catch Ebola, you'd have had to be in contact with Ebola, and hence you'd have had to have traveled to one of the Ebola-affected countries. This Trinidad does not have Ebola, and so there's no way that the person could have come into contact with Ebola.
Dr. Harvey says there is a coordinated international effort aimed at preventing the spread of Ebola. Prevention starts at the countries where there is an outbreak, with travelers being screened before leaving these countries.
It is followed up by the alert from our airport authorities, immigration, etc., and our public health nurses at our facilities. Anyone traveling from those suspected countries would be followed and monitored for a period to ensure that there are no symptoms.
He says Jamaica has a surveillance system in place to identify, isolate and manage individuals suspected of Ebola. Dr. Harvey explained that all hospitals have isolated spaces. Significant training of medical staff has been done on dealing with Ebola, and medical teams across the island have been briefed. Dara Smith, TVJ News.